Mental health disorders are conditions that affect a person's thinking, feeling, behavior, or mood, and may impact daily functioning and overall quality of life. These disorders are diverse in nature and can vary significantly in severity and duration. Understanding common mental health disorders is essential for practitioners as it provides foundational knowledge for identifying symptoms, supporting individuals, and creating effective care plans. While each disorder presents its own challenges, early recognition and appropriate intervention can lead to significant improvement and recovery for many individuals. One of the most widespread mental health disorders is depressive disorder. It is characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in previously enjoyable activities. Individuals with depressive disorder may experience changes in appetite, sleep disturbances, fatigue, and difficulty concentrating. In some cases, they may have thoughts of self-harm or feel that life has lost its meaning. Depressive disorder can arise due to a combination of genetic, psychological, and environmental factors. Treatment approaches often include psychological therapies, lifestyle changes, and support from a multidisciplinary team. Another highly prevalent condition is anxiety disorder. Anxiety is a natural response to stress, but when it becomes excessive, irrational, or persistent, it can interfere with daily life. Anxiety disorders include various subtypes such as generalized anxiety disorder, panic disorder, phobias, and social anxiety disorder. Common symptoms include excessive worry, physical tension, rapid heartbeat, and restlessness. Individuals with anxiety disorders often avoid situations that trigger their symptoms, which can limit their social or occupational functioning. Effective management typically involves therapy focused on relaxation techniques, restructuring negative thoughts, and building coping skills. Bipolar disorder is another significant mental health condition that involves extreme mood changes ranging from depressive lows to manic highs. During depressive episodes, individuals may exhibit symptoms similar to those of depressive disorder. In contrast, manic episodes are marked by elevated mood, increased energy, reduced need for sleep, impulsivity, and sometimes unrealistic beliefs about one's abilities. These mood shifts can disrupt relationships, work performance, and overall stability. Bipolar disorder requires careful monitoring and a structured approach that may involve mood regulation strategies, routine establishment, and ongoing professional support. Obsessive-compulsive disorder is a condition marked by intrusive thoughts and repetitive behaviors. Individuals with this disorder may feel compelled to perform specific actions such as checking, cleaning, or counting to reduce anxiety caused by obsessive thoughts. These rituals can become time-consuming and interfere with daily functioning. Despite understanding that the behaviors may not be logically necessary, individuals often feel unable to stop. Treatment generally focuses on gradually exposing the individual to anxiety triggers and helping them resist the urge to perform compulsive actions, alongside identifying and reframing irrational thought patterns. Post-traumatic stress disorder can develop after a person experiences or witnesses a traumatic event. Symptoms may include flashbacks, nightmares, severe anxiety, and avoidance of reminders of the trauma. The individual may feel emotionally numb, easily startled, or struggle with anger and trust issues. Post-traumatic stress disorder affects the way a person perceives safety and interacts with the world around them. Addressing this condition often involves creating a sense of safety, building emotional regulation skills, and processing the traumatic experience in a supportive environment through structured interventions. Eating disorders involve serious disturbances in eating behavior and related thoughts and emotions. Common types include anorexia nervosa, bulimia nervosa, and binge eating disorder. Individuals with eating disorders may have an intense fear of gaining weight, a distorted body image, and behaviors such as food restriction, binge eating, or purging. These behaviors can lead to serious physical health consequences and emotional distress. Addressing eating disorders typically requires a combination of nutritional counseling, psychological support, and medical care, with an emphasis on helping individuals rebuild a healthy relationship with food and their bodies. Personality disorders are a group of mental health conditions characterized by enduring patterns of behavior, cognition, and inner experience that deviate significantly from cultural expectations. These patterns often begin in adolescence or early adulthood and can affect all areas of a person's life. Common personality disorders include borderline personality disorder, narcissistic personality disorder, and antisocial personality disorder. Individuals may struggle with self-image, emotion regulation, interpersonal relationships, and decision-making. Effective support involves long-term therapeutic engagement, skill building, and working to improve interpersonal functioning and emotional awareness. Psychotic disorders, including schizophrenia, involve distorted thinking and awareness. Symptoms may include hallucinations, delusions, disorganized speech, and impaired functioning. Individuals with psychotic disorders may lose touch with reality, making it difficult to understand or interact with their environment appropriately. These conditions often require intensive and ongoing support. Treatment approaches typically emphasize building a supportive structure, enhancing communication skills, and helping individuals reconnect with their goals and daily routines. Substance use disorders involve the excessive or harmful use of substances such as alcohol, prescription medication, or other drugs. These disorders can alter brain function, impair judgment, and lead to physical, psychological, and social problems. Individuals may develop a tolerance to the substance, experience withdrawal symptoms, or continue using despite knowing the harm it causes. Addressing substance use disorders requires a comprehensive approach, including detoxification support, counseling, relapse prevention planning, and assistance in building a life free from dependence. It is important for mental health and wellness practitioners to approach each disorder with sensitivity, knowledge, and a commitment to individualized care. Understanding the common features and differences among these disorders enables practitioners to offer appropriate support and referrals. Additionally, recognizing that mental health challenges do not define a person but rather represent one aspect of their experience is key to building respectful, empowering relationships. With compassionate care and evidence-informed interventions, many individuals facing mental health disorders can achieve meaningful recovery and lead fulfilling lives.